Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the upper right segment where the sinus lining has been asked to be isolated. A little bit of a noteworthy thing. This is the upper jaw is completely covered by prosthesis. The upper right has 4 implants. The upper left has 3 implants, and they are ceramic and metallic bridge that we can see in the anterior segment as well. So there is a lot of scattering, but due to the MAR, we've been able to reduce the metal artifact that can be seen. So this is the upper coronal view. The coronal view is front to back. So I'm going to take you from the front. This is the anterior most implant. As you can see, this implant is placed slightly buccally, which has minimal bone support on the buccal aspect, but otherwise it is doing well. As we are moving posteriorly, this is the second implant, which is in the premolar region, and as we are moving to the molar region, this is the implant. As you can see, center of the ridge, perfectly placed. It is placed just below the sinus lining. This is the sinus lining right here, and we can see that the sinus does not show any inflammation. As we are moving, this is the sinus. There's no sinusitis present, which is also a wonderful sign. This is the distal most implant, which is present in the second molar region, and this is also center of the ridge. This one is not perforating the sinus either, so absolutely wonderfully placed. No sinusitis, no problems. So we should be fine there. So this is the sinus isolated in the upper right hand quadrant. We'll take you through the panoramic view. On the panoramic view, it is definitely difficult to see the sinus lining because of all the metallic artifacts that can be seen. But if we can move it to the molar and the second molar, so this is the transaxial view again. The first molar perfectly placed within the ridge, no significant bone loss can be seen, no sinus perforation as such, and no sinus inflammation can be seen, no mucositis or sinusitis. This is the second implant. Now I'm presuming this is a lining right here, so this is a could be a sinus lift procedure, but we can see perfect sinus lining and bone. So this is either grafted bone, because we can see a difference in this bone and this bone. So this is D3 and this is D4. So here we can clearly see that this might be a sinus lifted procedure, but otherwise there's no sinusitis, there's no scattering of any radio opacities in the sinus. So this is the upper right hand side quadrant. If there are any further questions regarding this case, please feel free to reach to our team. This is the implant on the upper left hand side. Again, this one slightly buccally placed. If we move to the other side, slightly buccally placed as well, but no peri-implantitis can be seen. And this one is placed much better center of the ridge, but not within the sinus limits, and no sinusitis, no sinus perforation can be seen. And significantly, it is placed just inferior to the sinus. Thank you very much.